Hello class, my name is Michael Abrashamian, and today I'll be talking about Alzheimer's disease. What is Alzheimer's disease? Dementia is a loss of brain function that occurs with certain diseases. Alzheimer's disease, AD, is one form of dementia that gradually gets worse over time. It affects memory, thinking, and behavior. Topics that are covered include demography, diagnosis, stages, pathophysiology, treatment, and prevention. Prevalence and impact of AD. The Center for Disease Control and Prevention lists Alzheimer's as the sixth leading cause of death. It is estimated that as many as 5.1 million Americans may have Alzheimer's disease. It is estimated that about half a million Americans younger than age 65 have some form of dementia, including Alzheimer's disease. Diagnosis. There is no single test that can show whether a person has Alzheimer's. Physicians can diagnose dementia, but finding the cause can be difficult. Steps for diagnosis include a thorough medical history, mental status testing, a physical and neurological exam, and tests like blood tests and brain imaging to rule out causes of dementia-like symptoms. Recommended specialists include neurologists, psychiatrists, and psychologists. Causes and risk factors. Age. At the age of 65, the risk doubles every 5 years, and after the age of 85, the risk increases by 50%. Family. Those who have a parent, brother, sister, or child with AD have a higher chance to develop the disease. Genetics. There are categories of genes that influence whether a person develops a disease. Risk gene and deterministic gene. APOE4 is the first risk gene identified and remains the gene with the strongest impact on risk. Scientists estimate that APOE4 is found in 20 to 25% of all Alzheimer's cases. Stages. Stage 1, recurring memory loss, issues expressing language and understanding, mild coordination problems such as writing and using objects. Stage 2, expanding loss of memory, which is continuous forgetting personal history, unable to identify family members and friends, speech rambling, and confusion about events. Changes in mood and behavior affected by stress. Delusional behavior occurs. Motility and coordination affected by slowness, rigidity, and terrors. Stage 3, severe loss of verbal skills, unable to care for self, and mobility problems with swallowing and illness. Mood behaviors become extreme with hallucinations, and the need for intensive care is necessary. Here's an image on the left with a normal brain, and on the right with a brain with AD with shriveled up cerebral cortex. An Alzheimer's brain experiences cortex shrivels up, impacting areas used for thinking, remembering, and planning. Hippocampus is significantly decreased. Hippocampus is involved in creating memories, and the ventricles grow larger. Here is another image of a normal brain on the left, and on the right, Alzheimer's disease brain. Pathology, amyloid plaques, neurofibrillary tangles. These are the two neuropathological that are consistent. Amyloid plaques form between nerve cells. Beta amyloid is a protein fragment removed from an amyloid precursor protein. In AD, these brain plaques form hard and accumulate, unable to be broken down and eliminated. In a healthy brain, they are broken down and eliminated. Neurofibrillary tangles found within the brain that are insoluble twisted fibers that are found inside brain cells. Tangles consist primarily of a protein called tau, which form a structure called microtubules. Microtubules transport from one part of the nerve cell to another. In AD, these structures are abnormal and microtubules collapse. Here is an image. On the left, we have a normal brain cell. On the right, we have a brain cell with tangles and plaques in the black and the brown. Treatment: acetylcholinesterase inhibitors and NMDA antagonists. Acetylcholinesterase inhibitors are drugs that are used to treat Alzheimer's disease, acting by inhibiting acetylcholinesterase activity. These drugs block the esterase-mediated metabolism of acetylcholine to choline and acetate. This results in increased acetylcholine in the synaptic cleft and increased availability for acetylcholine for postsynaptic and presynaptic nicotinic and acetylcholine receptors. Here's an image of increased acetylcholine in the synaptic cleft. NMDA antagonist. Memantine NMDA antagonist, which works by regulating activity of glutamate, an important neurotransmitter in the brain involved in learning and memory. Glutamate attaches to NMDA receptors, permits calcium to enter the cell, which is important for learning and memory. In AD, glutamate binds to NMDA receptors, allowing excess calcium exposure, which speeds up cell damage. Prevention: regular exercise, a healthy diet, mental stimulation, and quality sleep, and stress management. Regular exercise, 30-minute exercises 5 times a week. Balance and coordination exercises such as yoga or tai chi. Protect your head from trauma from activities like football, soccer, and boxing. A healthy diet consists of Mediterranean diet, fish, whole food, whole grains, olive oil, and fresh produce. Avoid trans fat and saturated fat, such as full-fat dairy products and red meat. Obtain omega-3 fats from sources such as salmon or trout. Mental stimulation. Learn something new, learn a new language, or pick up a new hobby. Practice memorization, strategy games, and puzzle games, such as Sudoku, crossword, and puzzles. These games provide cognitive association. Take a new road. Vary your habits regularly to create a new brain pathway. Stress management, breathing techniques, practice deep breathing, relaxation activities, and meditation. That is the end of my presentation. Thank you for listening and watching, and have a great semester.